All right, so it's kind of early. Just got up, just finished in Bible study. Now we're gonna get started with the day. Usually before going to campus, right now I'm on family medicine. So my day, and I'm on family medicine outpatient. So my day is me just being in clinic, helping to see patients. But usually while you're on a rotation, you have a shelf exam that comes at the end. So you spend really whatever time that you have outside of clinic, you try to spend a little bit of it studying. A lot of people use question banks as their study method for shelf exams. Once you get to the point of studying for like standardized tests, you usually use question banks as your means of studying. A lot of people use UWorld, a lot of people use Amboss. I've pretty much only used Amboss, but anyway, you try to get through the entire QBanks volume for whatever specific subject that you're studying for. So like right now I'm studying for my family med shelf. My goal is to get through my family med questions. So each day just try to break it up so that it's not too overwhelming. But the questions can be hard, but you need to go through the questions, practice them, figure out what you missed. I use Anki to like have a database of basically like recycling that information and getting it again so that I don't forget it. And then by the time you get to the test, it's like you've had a chance to see a lot of that information asked in multiple different ways because you went through a lot of different questions. So it's less about like reading textbooks and like watching videos and stuff, and it's more so question guided practice as you get closer to your board exams and just your standardized tests in general. But yeah, so I got to be in clinic at 8. I'm going to spend some time studying while also eating breakfast. I'm going to try to get through some questions. It's hard to study in clinic because you're seeing patients like all the time basically. So I'm going to try to knock some of that out now. Yeah, so I'll check back in with y'all later. All right, so I think now is a great time to sort of break the reality of what medical school is like. While I think a lot of people look at medicine and they see the respect, they see the finances, they see the success that comes with it. This is what it looks like a lot of the time. And you're committing, when you say that you want to go into medicine, you're committing to being a lifelong learner. You're committing to taking a lot of tests. You're committing to spending a lot of hours looking at the screen. And I'm not even gonna lie, sometimes you feel like you're not that intelligent. Sometimes you feel like your efforts are wasted. Sometimes it's like you're putting in the effort and it's not showing up in the results. You're gonna have struggles with passing some things, with being as successful as you want on some things. But yeah, I think just remembering the commitment, you have to have a stronger why than just I want to be well liked or I want to be financially successful. It's deeper than that, and when you have a motivation that goes past just the surface level, I feel like that's what keeps you going, honestly. But yeah, this is what a lot of Friday nights, Saturday nights have looked like. You probably also wondering like, why is this man eating Thanksgiving dinner for breakfast? Well, this is the food that somebody gave to me, so yeah, I didn't have time to make breakfast. Just had to eat what I had, which is also a lot of what med school is like, just getting by where you can, but eventually you get used to it, and it's not all bad. But yeah, that's the real deal. I might tell you a joke, but I never tell you a lie. If you want to go to med school, you're gonna be studying a lot. All right, so just finished studying for the morning, ate breakfast, and now I'm about to head out. About to be on my way to clinic. I don't live far from campus, but I'll check back in with y'all in a sec. But yeah, we about to get the day started. Let's get it, let's go. All right, so heading to campus now. I figure now is a good time to explain a little bit about like the difference between your years of medical school. There's a mosquito over here. Oh, okay, yeah, about the years of medical school. So your first 2 years of medical school are more traditional. It's kind of what you think of when you think of school. You know, you go to class every day. A lot of people go to class in person. Not a lot of people. Some people go to class in person. I was one of those people. I preferred to be, you know, in the actual lecture hall setting. But most people, they kind of just tune in and watch the lectures virtually. But yeah, the first 2 years in medical school are what we call didactics. It's clerkship or pre-clerkship. So you basically just learn all the fundamental basic sciences. You learn everything about the human body: anatomy, pharmacology, physiology, pathology. There's probably some other type of biology in there I'm forgetting. But yeah, you spend the first 2 years learning all the things, and then you take step one, and then you move on to clerkship. And in clerkship, you are basically, it's all on the job training from that point forward. You learn from seeing once you get to clerkship, and you learn by doing as well. So there are a couple core clerkship rotations that every medical school student all over the nation has to do. Family med, internal medicine, pediatrics, surgery, OB-GYN, neurology, and psych. So you have to do all of those rotations. They're like 6 to 8 weeks apiece, and while you're on them, you basically are acting as a intern for whatever specialty or whatever rotation that you're on. So you just have to, it's crazy because, you know, you may go into a rotation, you may go into your third year knowing exactly what you want to do, but it doesn't change the fact that you still have to go through rotations for all the other specialties. And it's interesting because you may be the type of person who, like I said, you already know what you want to do, or actually you may be the type of person who has no idea what you want to do, and rotations can be very helpful in figuring that out, because like I said, you get some on-the-job training, you get experience in whatever that specialty is like. So a lot of people, you know, they may come into their third year with an idea of what they want, but third year really helps them to hone in on what specialty they're going to choose. But yes, like I said before, I'm on my family med rotation. I'm doing an accelerated track at my medical school, so I came in having a pretty good idea of what I wanted to do. Really, I knew what I didn't want to do, so it was a little bit easier to cross certain things off the list, and it only left a few options after that. But yeah, I sort of skipped a portion of my second year and went straight into my third year. So now I am on my second rotation. I've done pediatrics, and now I'm on family medicine. Within each rotation, you have sub rotations. So for pediatrics, for example, while you're on peds, there are a lot of different forms of pediatrics, right? Like, not every pediatrician works in a hospital. Not every pediatrician works in an outpatient clinic. Not every pediatrician works in a nursery. So there are so many different avenues within each specialty, which is why third year can be really helpful as far as honing in on what you want to do, because you start to get a very diverse perspective on basically all the specialties, all the subspecialties. So yeah, I think that clinical year is, for a lot of people, it's more enjoyable. If you're the type of person who, you know, can't stand being in the classroom, first 2 years are rough. But if you're somebody who just enjoys learning, I think that if you stay open-minded, all 4 years are enjoyable. For most students, I don't even know why we call it the traditional pathway anymore, because it's not traditional at all. But that pathway where you go to medical school, you go to undergrad for 4 years, and then basically take the MCAT in like your junior year, apply find that has become less and less and less common, and more and more people are taking gap years, and some people are taking even multiple gap years, and having whole careers before they go to medical school. And I think at times it can feel like, man, I'm delayed, I'm behind, I've taken too long, I missed my opportunity, but that's not the case at all. I actually think that folks who come in with prior experience, as far as like working a career, or even having a family, things like that, I honestly think they come in with an advantage. Why? Because medical school is a professional program. You have certain expectations that are placed on you that if you are just coming out of school, it might not feel practical to say that you have to go to clinic for 8 to 12 hours a day, and then you have to go home and study afterward. For a lot of, and I'm not knocking traditional students at all, but for a lot of traditional students, it's like you've never had an opportunity to work a real job. You don't know what it feels like to be on the clock and not be able to stop and eat when you want to, or be able to go take a nap in the middle of the day if that's what you feel like doing. You don't know exactly what it's like to have to build your schedule around what someone else says that you have to do. So it can be difficult in that sense if you don't have the experience coming in from, you know, having lived a life before you started medical school. But that's just a little tidbit. I feel like if you are a non-traditional student, like, don't be discouraged. It's probably gonna help you out in the long run. All right, so I'm about to walk over to clinic now. I'll be there from, I think I'm scheduled to be there from 8 to 5. Probably have a little lunch break in between. So, because I won't have a chance to explain a lot of this once I'm actually there, I won't be able to get to my phone. But when I say I'm going to clinic, that just means I'm going to, right now, our family medicine health clinic, where we'll have patients scheduled. I'm scheduled to be with the preceptor in the morning and a preceptor in the afternoon. It'll probably be different. But basically, I'll be with the doctor. They have their own patient panel that they see regularly, and I'm just going to be there basically acting as support. You know, there may be, if they have 10 patients scheduled, they may want me to see somewhere between 3 to 5 of their patients. And what that looks like is I'll go in the room before them, check in with the patient. Well, I'll review their chart, you know, check and see what they're there for, what's their visit about, what questions do we need to be asking them, what medications might they need changed, what screenings are they due for, if a patient was maybe just discharged from the hospital, what questions do we need to ask to follow up on their hospital course, you know, things like that. Basically just staying up to date on the patient, figuring out what's going on. A lot of it is the first time that I'm meeting the patient, so just going in the room, introducing myself, getting to know them, building some rapport, and then afterwards I go back to my attending, give report, basically let them know a summary of what the patient's there for, you know, their chief complaint, questions that we should be asking, or questions that I did ask and answers that I got, and then also as far as coming up with a plan for whatever that patient's problem is. Figuring out, you know, do they need imaging? Do they need certain labs to be drawn? They may have a chief complaint that is undiagnosed, so what's on the differential? What are we considering? It's a good opportunity to build your clinical judgment, which I really enjoy that aspect of third year. I feel like when you're in pre-clerkship, you don't really get a chance to develop a clinical judgment, a sense of clinical judgment, because you're not really thinking about things clinically. It's different to say, you know, I know that we treat this infection with this antibiotic. It's something different to say this patient has this infection, they also have this other medical condition for which they take this medication, which would negatively interact with this medication. So instead, we're going to give them this, or this patient has an allergy to this class of medication. So instead of first line, we're going to use second line. Okay, we're going to use second line, but what dosing do we use? Okay, this patient's size is blah, 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 blah. If you're in pediatrics, this patient is elderly, so their clearance of drugs is different. So what dose are we giving them? Which medication out of that class? What's the research say about this drug versus that drug? So there's a lot more nuance to what you do once you finally get into the clinical setting, and it's not just about, you know, rote memorization of details anymore, and you're always constantly learning new things on the go. So it's gonna be a good day. It's gonna be a productive day. Hopefully I can tap back in with y'all. Oh, after I finish with clinic, well, not after, but in between clinic, my first and second half of clinic, I'm gonna go and be a part of this video. I have a professor on campus who is making a video. She wants some med students to speak in it, so I'm gonna go and support her and speak in that. But so I may get some clips of that, we'll see. But anyway, I love y'all. Pray for me, because sometimes clinic can be exhausting. It's a different type of tired because you have to be on all the time. But yeah, let's go, let's get it, let's go. Okay, on a little break from clinic. Just finished seeing the patients for the morning. So I worked with one physician in the morning, and this afternoon I'll be working with the PA. So we'll have a whole different patient panel. But yeah, just finished with that. Ate a little bit of lunch. Now I'm about to go run across campus and go and do this video for one of my other teachers. So yeah, clinic is fun. You get to see patients. Had a lot of cool conversations today, but hopefully I can tell y'all more later. Peace.
Hello, how are you, med students?
We love y'all.
We love you.
Give the people some encouragement for future med students.
We encourage you to make sure to take heed, learn all that you can, so that you can better serve the community, to build that medical home for them, and know that they need to be interactive in your care and their care as well.
That's it.
We applaud you.
Peace. So I just finished recording for Dr. Abraham Hilaire. Shout out to her. She's been a huge impact on my med school journey, but just wanted to throw out there that as a medical student, especially as a minority medical student, this journey is not just your own. You're really riding off the prayers, off the encouragement, off the resources, the aid provided by other people. And it's just so important to give people their flowers and just to be humble and remember that even though you may be the one wearing the coat one day, or you may be the one who gets that MD behind your name, that there were so many people who took the time along the way to help you, to support you. And sometimes it can feel like as a minority that you're just forgotten about, that you're a little fish in this big pond. But yeah, there are definitely people out there who believe in you, who love you, who care about you, who are fighting for you. So just always remember to keep an eye out for those people and to give them their flowers when you can. All right, so just finished clinic for the day. All finished now, officially. Saw all the patients for this afternoon. It was cool. This is my first time actually working with a PA, but advanced care providers are able to do so much. So yeah, it was cool. I feel like I learned a lot. And now I'm about to go to the library, finish up my questions for today, and then hit the gym afterwards. So see y'all in a little bit. Nah, no, y'all ain't think I was gonna go through this whole video and not talk about Jesus. Listen, in terms of all the work that we have to do on a daily basis, it really is a marathon and not a sprint. And the person that has 100% undoubtedly carried me through, it's been Jesus. There have been so many times where the fatigue got to me, where the frustration got to me, where the isolation got to me, all the things. But throughout all of it, Jesus has been graceful. He's been kind. I think not getting to go to medical school on the timeline that I had in mind forced me to be patient and to sit down and to develop a deeper relationship with Jesus. And I feel like he brought me to my knees before I ever got into medical school, and that was the best place to bring me to, because for the rest of medical school, I'm only focused on counting on him. So you can study hard, you can be intelligent, you can be disciplined, you can have, the perfect regimen, but at the end of the day, it's gonna be Jesus that has to carry you through. So shouts out to my Lord, to my Savior, to my Master, to my King. There is no me without him. So if you thinking, wow, he looks like he's handling this on his own, I'm not, bruh. You looking at a person who's covered by grace, who's dependent on Jesus. That's the only reason why I'm making it through. All right, so we are officially finished with clinic, with studying for the day. This is a pro tip, but I mean, obviously it's not going to be the case for everybody, but I personally do not really do things past 5:30. One of the things you'll learn in medical school, or that you have to get used to, and I don't think this is just medical school, I think this is just life in general, you're gonna always have something else that you could be doing. Like, the end of a day doesn't mean I finished everything. Like, it just means I've finished what I have the capacity to do today. And then, you know, whatever I didn't get a chance to do today, we pick it up and we start with it again tomorrow. But I think it's important to just get in the habit of pacing yourself. That's something that I think very high achieving people don't often do very well. We get super carried away, and it's like you have this sense that you have to do it. Like, it's urgent that I do this right now. And like, you know, I don't remember who told it to me, but very early on, people taught me, you know, there is a difference between things that are important and things that are urgent. Like, the things that are urgent, yes, take care of them in that moment or as soon as possible. But for things that are just important, it's better to be consistent and to chip away at them versus trying to do everything all at the same time. And I think one thing you'll learn in medical school is that you have to set those healthy boundaries for yourself. And again, like I said, this isn't just medical school. I think this is just life in general. If you're gonna have kids, you're gonna have a family, even if it's just you, to prevent burnout, you have to, when possible, set boundaries. There are gonna be times where you can't pace yourself. You gotta sprint. Like, it's required of you that you sprint. But generally speaking, if you can avoid it, you would be doing yourself a great service if you put things in place to make sure that you weren't having to scramble or sprint all the time. I think about my time in undergrad. I think that's when it really clicked for me that procrastination is just not it. Like, and I know for folks who are like watching this video, you're probably very intelligent, you're probably super smart, and I'm telling you, when you get to medical school, that does not matter. Like, everybody here is super smart, everyone here is very intelligent. As a matter of fact, the challenge of medical school is not your ability to understand the material. It's all, you know, relatively speaking, it's all simple material. If I tell you this is the disorder, like, this is what it looks like, these are the things that you'll see, there's nothing complex about having to know a particular disorder. What makes it difficult is that there's such a high volume of information. There's so many things that you have to know, and like, you're just not going to be able to cram it all into your head at one time. You're not going to be able to force all that knowledge down. You have to be able to like slowly digest it. And so that means starting early. If you're studying for something, start early, give yourself lots of time, pace yourself, figure out what your capacity is, figure out the times of day where you are most productive, and like work during those times. And if you're not productive at a particular time of day, like, go to the gym during that time. You know, this is mostly for like pre-clerkship, because you can't really do that once you get to clerkship. But while you have that free time, if you know that the middle of the day sucks for you and like you can't focus to save your life, then go to the gym during that time. If you know that, you know, from 6 p.m. to 8 p.m. is like your prime time of studying, then like build your schedule to make sure that you're optimizing your time. I think that's just, if I had to sum it all up, like, that's probably the biggest thing, is to work smarter, not harder. And just because you're putting in a lot of hours, that doesn't mean it's going to translate to success if you're not putting in the hours in an effective and like well thought out way. So yeah, I know there are people who study a lot more than me. I know there are people who study a lot less than me. I wouldn't say I'm like exceptional or anything. I'm like probably like middle of the pack. But if you want to be able to be successful and like you want to have longevity and you want to avoid burnout, then you gotta learn how to put up barriers. You gotta learn when to say when. You gotta learn when to close your laptop and just wrap it up for the day. But yeah, I'm about to go to the gym, which is basically just recess for adults. That's what I'm about to go do. About to go hoop for a little bit. Probably won't record any of that, but yeah, I'll talk to y'all later. All right, so that's it. Had a chance to walk y'all through what a pretty typical day looks like. Again, this is me in my clinical year on a specific rotation, but different rotations look different. Different years in medical school look different. But the reason I recorded this was just I feel like I didn't have a whole lot of context as to like what this would be like, especially as minorities or just underrepresented individuals in medicine. I think it can be very discouraging sometimes to feel like you're walking this path alone. So if you're interested in medicine, if you're already in medical school, if you are just trying to figure out life in general, I feel like some of the things that I talked about in here, hopefully it was helpful for you. Hopefully you found it encouraging. But yeah, I love y'all. This is none of this was fancy. I didn't prepare anything crazy today. This was really a regular day, like regular. So yeah, like I said, I hope that y'all enjoyed it. I hope y'all got something from it, and yeah, tap in with me.